this time.
Holy buddy.
Dr. Michelle Oakley's stepping in to break up a brawl between brothers.
Uh-oh, shoot.
And must call in the cavalry to take down a high-strung horse.
I'm coming down.
Plus, Michelle dives into action to catch a feisty bald eagle with a bum foot. As a traveling vet, Dr. Michelle Oakley serves animals across the vast Yukon Territory.
What? How do you get this thing to turn on?
And runs clinic days in several different spots.
A clapper would be awesome. Okay. This newfangled technology.
Today, she's setting up shop at All Paws Clinic and getting ready with vet tech Jamie. Their first patient of the day turns out to be quite the character.
Come on, Len.
Good timing. Watch your step. We just scooted the scale out.
Lenny, come on.
Lenny is a 5-year-old Vietnamese pot-bellied pig.
Lenny, you can do it.
This heavy ham loves bananas.
Oh, that made you mad, huh?
What she doesn't love, hoof trims.
When we try to trim Lenny's hooves at home, she hates it. Lenny is very hard-headed. She's very irrational, and she's the love of my life.
That's a good girl. I know, you don't want to get on the scale, I understand. Pot-bellied pigs often have very dominant personalities. They bite, they'll get really grumpy when you try and get them to do something they don't want to do. We've had some of our staff bit by pot-bellied pigs before, so we just sedate them and we do it that way.
Oh, no, you can do it. She's been sitting around all winter, so she's got to get on the scale.
Come on, Len. You can do it.
Before Michelle knocks Lenny out, she needs to figure out the correct dosage of sedative. And to do that, she needs Lenny to weigh in.
Can't cheat on your diet. You can't cheat on getting on the scale.
Exactly.
Come on, Len. You can do it.
Lenny's no fool. In fact, some consider pot-bellied pigs one of the most intelligent domestic animals.
They get her on the scale, great, but I'm not real hopeful or optimistic.
I have no more banana.
If I can't get her on the scale, I'm gonna have to do an estimate.
Pot-bellied pigs are generally smaller than their farm cousins, but their size can be deceiving.
Treat her back this way.
Their bodies are more compact than they seem. A 100-pound pig could appear to be the same height as a dog that only weighs 30.
God, she just loves banana peels.
Okie dokie. What we're gonna do is go ahead and give her the injection. She's gonna scream like stink, just because any poke, you know, basically I think a mosquito poke and they'll scream.
Yeah, yeah.
We have to do a big needle injection into her ham, which is basically her big rump muscle there at the back.
Okay, I'll get out of here for that.
If you need something to distract her, she loves getting scratched with a fork.
Really?
Yes,
fork.
yeah, forking the pig. She
Okay.
loves it.
Forking the pig.
Yeah.
Good luck.
She can turn and get me with a tusk, you know, very quick. So Jamie's gonna use that to basically keep her away. You ready? I hope so. It's okay, sweetheart. All done, all done.
Good girl.
Quick, fork scratch.
Fork scratch.
Fork scratch. Oh, that's a spot. Oh, look at her. Oh, my lordy, you like that, huh?
What?
Normally pigs don't like it when you come at them with a fork. Okay, that's all.
Michelle's based the sedation dosage on an estimate of 120 pounds for Lenny. If that's too low, the pig could wake up from the sedation too soon. Too high, and the drugs could make the pig's heartbeat and breathing dangerously slow.
She's starting to wake up a little bit. Don't even think about waking up yet. No, we're not ready for you yet. No, no. I'm just taking little bits because I don't want to cut the fleshy part of their foot at all, this pad. I'm just trying to pick away at the edges here and get them back as far as I can. Get all those toenails, gross.
Toenail maintenance is more than just cosmetic. When the hooves grow too long, a pig can become injured or lame.
Getting closer. Alrighty, the best piggy pedicure she's ever had. Now we'd love to get a weight on her. Oh goodness, fat little pumpkin. Oh, Oh, she's way more than 120 pounds. Oh my God. No wonder she didn't go down. Holy frick. Oh my God. 70 kilos, 150.
At 150 pounds, Lenny's getting a little heavy. So this oversized oinker's going to have to keep an eye on the scale and her waistline to stay healthy.
Okay, whoop, whoop, whoop. Hold still, big mama. I'm gonna work with Sasha and Fred to put Lenny on a diet. Hopefully, if she loses a little bit of weight, she'll feel like being more active, and that activity will wear down her hooves and will mean fewer foot trims. We forked the pork.
Lenny will return in 4 to 6 weeks for a follow-up trim. Until then, it's back to a life of banana peels and fork scratches.
God, can we charge more for these?
Next, Michelle's off to her first house call of the day. Today, she's visiting an old patient suffering from persistent mobility issues.
So this horse, Fancy, I saw this horse last year. Basically what she's doing is, like, her legs seem to almost freeze up, but then she does, like, kind of a funny lift to it. I've seen her in the past. She has a really funny gait. She's got a hitch in her giddy up. We weren't entirely sure what's going on, but we think it could be a condition called string halt, which caused them to do a very odd lift of their leg, and it's been going on for several years.
Michelle's bringing along equine surgeon Dr. Amy Doyle to get an expert opinion.
I thought, since you're here, we can help them get her back moving all 4 feet like they should.
Okay, well, let's have a look and see what we can do for her.
Sounds good. Dr. Doyle has seen a lot of these different types of cases. She's able to do surgery on a string halt if that's what it is.
And there's Fancy.
So I'm hoping we can try to get some resolution for Fancy because we've been trying for a while now. Hey, Mandy.
Hi.
Nice to see you again.
Thanks for coming out. We run a horse packing, trail riding business. It's important for us to have healthy, happy horses. And Fancy is really great with small children or people who are nervous to ride. We always put them on Fancy because she's so solid. She's our best horse, so she means a lot to us.
How's she been doing?
She's been pretty sore on the back end.
Could we have you move around a bit so
Yep,
we can
you
watch
bet.
her? Okay, that would be great.
Michelle and Amy examine Fancy's gait. What they notice is startling.
Oh, whoa. That was the other leg.
Yeah, you're right. That was the other
You want me
leg.
to turn her?
Yeah, come on back. Yeah, now she's locked on that leg again. Huh, she's doing it on both legs.
The weird thing today is that when we've seen Fancy before, it's always been her right hind leg, and today her left hind is actually doing a really obvious locking of her leg.
Both legs locking means Fancy's condition is getting worse, which makes finding the root cause all the more urgent.
Can we see if she'll back up for us? So see how she's
on the
locked
left,
there?
Yeah. Okay.
This isn't string halt,
Okay.
but
yeah, she's
definitely locking. Her
Okay.
patella is getting locked and not
okay.
releasing. I do realize that this is not the original problem that we had of string halt, that this is called upward fixation of the patella. So what's happening when she catches there is her patellar ligament is getting stuck on
Yeah.
top of her patella. That
Yeah.
right there.
Oh.
And she can either do this, swing the leg around
Yep.
because she can't flex it,
Mhm.
or she'll get it to a point where eventually it flips off, and that's when
She'll
it
do that
catches,
funny
and
thing.
she does that little jerk.
Okay. Basically, fixation of the patellar ligament, a certain ligament that's holding the kneecap, is catching, and she just can't move it at all.
Right now, a sudden jerk of Fancy's leg will certainly throw her off balance,
Yeah.
and that puts her at risk of falling.
So, because we've been dealing with this for 3 years now, my recommendation is that we go ahead and do a surgical treatment on her to release that. So it makes it much easier for her, and she will not have this problem basically as soon as we do this. So our plan will be to actually cut that ligament so that it no longer gets locked up over the patella, so she won't have this problem in the future.
Operating on both legs presents a special set of challenges. But that's not what has Michelle excited.
I haven't had any cases of it up here yet, so it's pretty handy to have Dr. Doyle around. We're gonna go ahead and do the surgery on Fancy. She needs it on both her knees. Amy's gonna do one surgery, and I'm gonna learn it while she's doing it, and then I'll do the next one.
The team will start by sedating Fancy.
Okay, this is an injection for sedation. Hold on, Fancy. Okay, we got it in there, sorry. Now you're probably not gonna let me come back, though.
Because of her size, Fancy will need multiple sedative injections directly into the vein.
Hold still. Actually, I'll hold her, hon, and you can just take this in the back. That's a girl.
And that means getting her to stay still.
Walk right back up. Fancy apparently has an issue with needles. It's a hard thing for horses to get used to, especially in the jugular. You don't need a hitch in your giddy up. It's like, you know, a poke and a sting, and of course they're gonna try and defend themselves. Yes, she's
got her eye on me
I
already.
know. She's like, wait, whoa, what?
Michelle works to relax Fancy as Amy readies the syringe.
Even just coming in close to do the IV injection, she's already like really tense and really sensitive. Come on now. So there's definitely a safety issue.
Amy needs to insert the needle directly into Fancy's vein.
That's like the teeny needle. You're so tough. You're a tough girl. Still. Hold on, Fancy.
Fancy the horse is giving it all she's got to fight a sedative injection ahead of a much-needed leg operation.
Funny for such a big horse, she's so touchy with needles.
Got a few more to go, so
Hold still.
she's got her eye on me
I
already.
know. She's like, wait, whoa, what? Even just coming in close to do the IV injection, she's already like really tense and really sensitive. Come on now, come on now. You don't mind those pokes. That's like the teeny needle. You're so tough. You're a tough girl.
You all right?
Yeah. Oh, I knew it was coming. But now she's mad. We have to give Fancy multiple injections into her jugular vein. It's just a lot more predictable and a safer way to sedate her. But it's a small target, and she's moving around way too much. And if I miss, I could go right into the carotid, which is very dangerous.
And Fancy doesn't appear to be calming down anytime soon.
No, you don't trust me at all, huh? I mean, there's a couple problems here. We have Fancy very nervous. She's very upset about it. And I'm not able to get in her position to safely give an injection where she can't get at me. Whoa, whoa, whoa. I'm not even touching that. So there's definitely a safety issue. The other issue is this is not good for Fancy. I think that's safest, because we're both on either side of the fence.
Their options are limited, so Michelle goes back to her playbook to come up with a new plan.
She's already apparently has an issue with needles. We don't want to ruin her at this point. It's just too much moving. If there's a way to get her somehow pinned against the fence, then I think we can do it.
They decide their best bet is to rig up a makeshift horse squeeze to keep Fancy in place.
So we're just gonna actually have some hay bales brought in here, and we're gonna use it to pin her up against the fence. And then I can hopefully just reach right in and do a hand injection.
Although these hay bales are extremely soft, they should provide a nice solid barrier to prevent Fancy from moving.
Beauty! Perfect. So now,
Just try to walk her right in
try
here.
to walk her, and then
Okay.
there's a space for you to get out.
Yep. Come on.
There she goes.
Come on. Easy girl. Easy girl. Easy girl. There you go. There you go.
We're gonna try and do a hand injection right now, and hopefully no one gets hurt. So I'm not gonna be able to get an injection into her jugular vein, so I'm just gonna go for an intramuscular injection into her shoulder. She's gonna go snaky here in a second, so everybody ready? Oh, yep, I know. Even that broke it.
Like trying to drive a nail into a rock, Michelle's needle breaks on contact. Fancy's muscles are too stressed and tense for the injection to take hold.
Mad. It broke like instantly when I started to put it on there. All right. This is gonna be our last try, and then I'm done. I need a better system to restrain her. We can't keep doing this, and we can't keep, you know, like, we're risking getting hurt here. We'll try, but this is probably not gonna work either. That'll be it.
There's 10 seconds in the third period.
Okay, Fancy, you need to be tough. Are you ready, girl? Are you ready? There you. Be tough.
It's another slip of the needle.
I don't want to ruin her. Like, I'm really worried
Yeah.
about her already being so traumatized, so
Yeah. Okay.
we don't want anyone to get hurt. No. So, sorry, but we need a better setup or,
Yeah,
you know,
yeah.
something, so.
Yeah.
We've decided to call it. Darn, never been had by a horse before like that. You know, it's a point where I don't want to push Fancy anymore. No one's got hurt, that's great, but we're gonna keep it that way.
Fancy still needs surgery. Luckily, they've got time.
We still have some options. We've been talking about doing it another day. We'll lose Dr. Doyle, but she's gonna show me how to do the surgery, and then we'll find someone help us get her down, and then we'll go from there.
Yeah, sounds good.
Okay. See you later, buddy.
See you next time.
Give me 5. All right. Okay.
Michelle and Amy throw in the towel for now. She'll try again later, when she can bring in the right reinforcements to properly restrain Fancy. But there's no shortage of patience. Now, Michelle and Sierra are off to the American Bald Eagle Foundation in Haines, Alaska, to check in on a feathery friend.
Bella, a while ago, flew into a power line and ended up losing part of her right wing. So because of that, she obviously can't survive in the wild, she can't hunt or even fly very well. That's why she's here, and today is the day for her annual checkup.
Bald eagles are known to be feisty. Even with only one wing, Bella is sure to give the team a run for their money.
Those are for me? Yep. Okay, and I guess we'll need a net and a big towel or blanket or something. This is just to kind of hold Bella down. Once we get her in the net, cover her up and keep the stress down. Leah's gonna run the net, and whoever's closest will get in and grab legs. And you gotta really hold on to those feet so that her talons don't get you. They basically have 4 knives on each foot that are razor sharp, incredibly powerful, and could go right through my hand. And they definitely don't like being held down.
So catching her is guaranteed to turn into a wild goose chase.
We're ready. Hi, Bella. Get ready with the blanket if we need it. Hey, Bella.
It's time for Bella the Bald Eagle's annual checkup.
Get ready with the blanket.
But taking down this freedom flyer is no breeze.
No.
Are you okay?
Yeah, I'm fine. I don't know about the Mew, and I just slipped in all her poop, so sorry.
Ooh.
Oh, she's got a bumble. As we're looking at the pads of her feet, we're definitely picking up some areas that have been rubbed a bit, and they're also thickened, and one in particular is ulcerated and looks like a bumble's just about to start.
I'm gonna get the hood on.
Now, bumblefoot is very serious in raptors, especially captive raptors, because it's a lot harder to manage their feet in captivity than they have to deal with in the wild.
Okay.
I'll bring the net and my soaking feet. In the wild, they move around. They're on different perches. In captivity, sometimes they'll pick one favorite spot. But when they just sit at that one spot, on that one perch, it tends to put a lot of pressure that they wouldn't normally have, and that can tend to start to put cracks or ulcers in their feet. And then because they're walking around on feces or the dirt, that gets in there, and then you get an infection started.
An infection that, if it spreads, could permanently damage the tendons inside Bella's foot.
So first things first, we're gonna look at her feet because they looked not so good.
Then we'll open it up.
You got it? So she's got a bit of a bumble here. Let me clean it up a bit.
Bella's missing part of her wing and will never live out in the wild again. So it's imperative Michelle treat Bella now before the bumblefoot gets worse.
A bumblefoot is really hard to get to heal, especially in a captive raptor. She's got some pretty serious cracks, eh? Worst case scenario, you get a bumblefoot that gets in tendons or gets in bones. That ends up being a bird that you have to euthanize. It's not something we can mess with. So I'm just gonna rinse her feet. See, if you look here, I don't know if you guys can see that, but as soon as things get dry, Like here, you see how it's getting these great big cracks in there? They're not very movable. Every time she moves her foot, that crack is just getting bigger, and then that's how you get a bumble start. You get bacteria up in that crack, and it just gets worse and worse. So the treatment for bumblefoot is moisturizer, and we're gonna put a bandage on there, try to keep the moisture up against that and keep bacteria out.
We're bandaging the foot, the whole foot, and nothing but the foot.
And then we're gonna actually give her some antibiotics as well, and we'll put that in her food, and she'll be taking it orally for, probably we should do about 2 weeks.
Okay.
We're almost done. There we go.
Perfect.
Awesome.
With her bumbles safely under wrap,
Okay, 1, 2,
the
3.
team prepares to release Bella back into her muse.
We put both feet in bandages because she had a couple cracks in her other foot as well, but not as bad. Watch out for that pool. And that way she'll have some padding.
So crouch low.
These bandages are gonna be changed every few days to make sure it stays clean.
1, 2, 3.
Aw, look at her. Looks like she's got her cruising boots on. She's like sneaking around. I'll stop back and check on Bella soon and see how she's doing, but I have a lot of hope for her.
It's finally time for fancy surgery, and it's a first for Michelle. She's going to repair 2 injured knees without the aid of equine specialist Dr. Doyle.
Hi. Hey, how's it going, guys?
Good.
Are we ready to do this again?
Yes.
Okay.
Dr. Oakley came back out today to do a surgery on Fancy. Last time things didn't go super well.
Okay, Fancy, you need to be tough.
Last time, Michelle couldn't get Fancy calm enough to give her a sedative to even start the operation.
Be tough. Sorry, but we need a better setup.
And this violent behavior has forced Michelle to call in backup.
So I'm just gonna cover these. Today, we're a little bit more prepared, knowing that she's gonna be really difficult about needles. I've got Dustin Elliott here to give me a hand.
How long do you think it'd take for the drugs to work when we have to run a rope on her?
Dustin is a local outfitter, which basically means he's like a Yukon cowboy, and he has tons of horse experience, and that makes him perfect for situations like this.
But we can get a rope around it without
Yeah.
too much trouble anyways.
Okay. He's gonna rope her and then hopefully just put her right down on the ground, then put a catheter in, then start the surgery.
We'll throw the halter on her,
Yeah.
just so you have something to grab onto when she goes down.
Yeah. So Dustin's gonna try and just get a rope around one leg, loop it through a rope around her neck, and see if you can, sometimes if you pull up that back leg, they'll sit down, and then you can finish getting them down.
Horse roping, or casting as it's also known, is a common technique out in the Yukon where options for restraining horses are limited.
You know, a lot of folks working with veterinarians or, you know, working around farms are able to cast horses, and it is definitely a safe method. Do you want me to wait until you need a hand? Like, probably the less the better.
Yeah, probably we'll just go in there and we'll start roping her up.
But it does look a little rough. It's often tough for the owners to watch.
And given how uncooperative Fancy was earlier, Mandy can't afford to roll the dice again.
I guess, like, if it just gets too crazy, I just want to call it off. Because I don't want her to...
feel totally comfortable doing that.
Okay,
You just
all right.
jump in and say, nope, that's it.
Okay,
And that's
all
fine.
right, okay.
The animals for us they're a big part of our livelihood, but they're also our family.
You want a blindfold her?
Yeah, it might not hurt.
I've got a towel here.
They're all really important to us, and it's important that they're comfortable and happy and well cared for.
Can we bring her a bit forward, so she's away from that post?
Blindfold makes it harder for her to see what Dustin's trying to do. He's trying to get a rope around her back foot. She keeps watching him, so she can't get over to a good spot to do that.
Yeah.
Oh, keep it up, keep it up, keep it up, keep it up, quick. I'm pretty sure Dustin can get a rope on her and we can sit her down. It's just a matter of the mechanics. If you get the rope around their feet, you bring it up around their neck and you pull their back feet up, they're gonna sit down. And once they sit down, if you have their front feet hobbled, they're not gonna get back up.
Dustin must crouch down to get the rope around Fancy's leg. He's now totally exposed should Fancy begin kicking. He quickly secures the ropes. Now, the next challenge, lower Fancy to her knees.
Fancy is a big horse, so she's probably close to 1,200, 1,300 pounds. So she's a big girl to bring down, and she's still fighting us. Come on, Fancy, sit down. That's a girl. Sit down, girl. Good girl.
Just go down, Fancy.
Come down.
Come on, Fancy, sit down. That's a girl.
Fancy the horse is putting up an epic fight against Yukon cowboy Dustin Elliott. And that's keeping Dr. Michelle Oakley from performing a much-needed leg operation.
She's still fighting us. You know, she's afraid of what we're doing to her. So as quick as I can get that catheter in, I'm gonna get some drugs in and just try and flatten her out.
Come down. Strong.
Dustin's careful maneuvering finally brings Fancy to her knees.
So we got her sitting. As soon as he gets her front feet hobbled, she won't be able to move her front feet independently, and it'll be easier to pull her down.
Grab that rope, please.
Boy, keep her head up like that.
Yep. All right, you guys good? I'm gonna go get stuff for catheter.
Fancy's restrained, but the hurdles for Michelle are just beginning.
Hey, Fancy. Okay, so I'm gonna try and get the catheter right where your knee is.
And Fancy's fear of needles is making it worse.
Yeah, you really don't like needles, do you? I mean, all this and you're still fighting a needle. Come on. Jesus. Okay. When you get them down like that, horses do a lot of because they're sort of fighting it a bit still. As soon as I give her a little bit of anesthesia, try and relax her, her breathing will level out. Angle is tricky here.
Got it.
Yep. Okay. Okay, just let that rip for a minute.
She's still fighting, but she just doesn't have the strength.
Yeah.
It's taken 5 people about 2 hours, but Fancy's finally sedate. The catheter will keep her that way, supplying her with a steady stream of medication to keep her under. Still, Michelle needs to stay alert.
So I've actually never done this surgery before. Dr. Doyle has walked me through it in a lot of detail, so I feel prepared. But when you're doing something for the first time, there's always a bit of apprehension. So we're just getting ready to get in there and get the job done finally.
Michelle will be cutting one of the 3 ligaments inside Fancy's leg that hold the knee bone in place. This will loosen up her leg and allow Fancy to move with ease.
It might still do a little bit of clicking. It may even catch a little bit, but it's not gonna at least lock her up, so she's having to like drag her whole foot around to even move. Okay. Stop, do it in and just leave it. Yep, that's good.
Michelle must be careful. Cutting into the wrong ligament could potentially leave Fancy with permanent damage.
I have to find the right ligament. I have to get underneath it, and then I have to cut it. Can you flex it again a little bit?
Yeah, coming up.
Okay, stop. There. Okay, I'm just cutting. I'm just trying to get at the ligament to get underneath it to cut it. Man, it's hard to find on here. Oh, this is supposed to be the fast part.
This time we were just hoping things would go a bit smoother, and seeing Fancy get the surgery, I was fairly concerned about that.
Okay, go ahead and flex it. Okay. Oh, back up a bit. Okay.
Right there?
Yep, right there. Okay. Cut. Does it lock at all? Flex it and straighten it out. I'll try and flex it.
You got it.
Okay. Doesn't seem to be locking back up, so I'm gonna go ahead and close that up and get to the other one while I can. I know I have the right ligament. I was 100% sure of what I was cutting. Halfway. And I learned a little on this one, so maybe the next one will be faster. So now I finished the top leg, and I'm gonna start in the lower leg. Okay, I'm getting ready to cut.
Okay.
This one's way easier to feel. I'm actually finding this one a little bit easier to feel the ligament, and you know, it's just a little bit better position. I can feel it. I think that's it right there, the big tense one. Got it all. Next step is just closing this up. I knew this was going to be a tough surgery, but we got through it, and sometimes that's just what you have to do up here. Okay, Fancy. This is a perfect example of how I can become a better vet for my patients. Keep doing new procedures and keep learning. All right. Okay, you want to let her up? Come on, come on. Oh, come on, sweetie. There you go. That's it. Stay.
There we are.
Stop. Oh, God. Normally when you do this surgery, it's immediately apparent. In Fancy's case, it's going to be a little trickier to see because she's been down for a while. She's doing quite a few stagger steps. But when she moves, she's definitely moving through it.
So what should I be watching for?
You got to really watch for any kind of swelling.
Okay, sounds good.
She's getting more steady now. Okay, well, I'll start moseying out of here, but if you can just keep an eye on her, and maybe you can text me later this evening.
Sounds good.
Yeah.
Thanks a lot.
We got it done. You really want to shake my hands?
That's okay. Mine aren't as dirty as yours, but they're still dirty.
It looks really good. I'm very hopeful.
Thanks a
All
lot.
right,
Have
take
a
care.
good night.
You too. Now we got to really pay attention to what's this going to be like over the next couple days.
A new day brings a new location and a new set of challenges. Today, Michelle's in Sitka, Alaska, located in the middle of the state's southeast strip.
Whoa, this is so pretty.
Along with Sierra and vet tech Tracy, they're heading to Fortress of the Bear Animal Sanctuary to examine an injured resident.
He has some wounds, having some scraps with his buddies, so it sounds like they're going to be able to bring him into a squeeze setup so I can get up close and do an actual exam and we can check out his injuries. Hello.
Hi.
Sanctuary Director Les Kinnear has been rehabbing nuisance bears for 9 years.
Well, thank you for coming out. We got a couple bears we'd like to have you look at.
Oh, we'd love to see them. Let's get started.
All right, let's go. Fortress of the Bear is dedicated to recovering orphan bear cubs around communities in Alaska. Toby, up. Yeah, good girl.
Instantly.
We bring them in, work with them, clean them up, train them. I don't have anything for you, honey.
There's a sign for more.
Until they're big enough, strong enough, fast enough, smart enough to put back in the wild.
Les may have these bears standing on command, but they're still wild animals, and their behavior is unpredictable. On average, there are over 7 bear attacks on humans reported each year in Alaska.
Okay. All right.
Les will have Michelle examine the bears from outside a special handling cage to make sure she stays safe.
This bear is Kilsnu. He's a male. Okay. He's 9.5 years old. He was the runt of his litter, subordinate to his larger brother. And eventually he got himself between the two of them, and so he got some bites.
Okay.
Kilsnu is one of 8 bears who call the Fortress of the Bear their home.
This is Shaik.
Whoa.
Close to 1,000 pounds.
So I'm about to start the exam on Kilsnu, and his big brother Shaik forced his way in there too. Holy buddy. You really just can't have 2 bears in a small space. It's gonna be a problem.
There's Kilsnu.
And this alpha male wants to make sure his dominance is on full display.
Shaik.
Uh-oh, shoot.
This is Shaik.
Whoa.
Close to 1,000 pounds.
Dr. Michelle Oakley is about to begin a checkup of a burly brown bear.
There's Kilsnu.
When she lands in the center of a sibling spat.
Shaik.
Uh-oh, shoot. He just saw the camera. Oh. Oh, no.
Shaik. Shaik, get out off of it.
You know, as entertaining as it is to see them having a bit of a tug of war with the little camera, we don't really want him chewing and eating it. It probably isn't good for him.
Shaik.
An adult wild brown bear can eat about 90 pounds of food a day.
Come on now. Hey.
Unfortunately, turning this little camera into a light snack could wreak havoc on Shaik's digestive system.
Right here, look, I got some food for you.
But all this commotion presents Michelle an opportunity of her own.
Would you like to take a look at Kilsnu while he's right here?
Right.
There you go. He says, yeah, come on. Here you go. Forget about the camera.
So I see the one wound on his back here. Yeah, it's got a little bit of a dig in there, doesn't it? So he just has a wound on his back, a bite from his brother likely. It's not that big, and bears are amazing at healing themselves. They get bites like this all the time, but it would be good to try and flush it.
During a previous fight, Kilsnu suffered a deep gash. An antiseptic flush of the injured area should prevent an infection from forming and allow the wound to heal naturally on its own.
Such a good boy.
I didn't think we'd get this chance, buddy.
Good boy.
So this is an antibiotic and anti-inflammatory that you can put inside the mammary of a cow.
Okay.
And it's actually really nice for wounds that are kind of punctures, so they can get down in there. So
great.
It'll look like pus coming out, but it just kind of filled that pocket. So it'll really help a lot.
Amazing.
That was he was amazing. We got really lucky there. Sorry for the pokes, but we want to get rid of that. We want to get rid of that ugly bite from your buddy. Now I know that wound is full of antibiotic and even a little bit of like anti-inflammatory, so that's going to help everything start to close up on its own.
I'm so pleased that you guys are going home with that camera.
We certainly appreciate taking a look at him for us.
No problem. He looks great. Well, thanks for having us out here. It was a fantastic day. Thanks a lot, Les. See ya.
All right.
Back in Haines, Bella the bald eagles had a few days of bumblefoot treatment. So it's time for Michelle to check her progress.
Bella, come on. Work with me, jeez.
Okay. Let's see what we got here. Oh yeah, this is pretty good. Okay. It's a lot better though than it was, so that's good. So Bella's feet are looking great. Hee hee hee. Tickle, tickle. The staff are doing a great job for Bella. They're keeping her feet moisturized and really clean. They're changing those ball bandages, which are really important to keep that weight evenly distributed on her feet. And because of all this good care, her feet are getting back to normal. Here comes the slippery part. So this is a bit of argan oil. We're just really trying to soften this up. I mean, raptors' feet are really well adapted to their environment. They're basically scales on their feet that have been kind of elongated and helps them grip on branches. But those pads and scales don't do well if they have pressure in the wrong points. Let's get that in there. Oh, nice pedicure for you, Bella. You're so good. I'm definitely optimistic for Bella. As long as we keep changing the bandages regularly, which will distribute the weight evenly on her feet, and really intensive medical management with her antibiotics and keeping everything clean, her prognosis is excellent. Ready to go, Bella, Bella, boo. Good girl, Bella. It's hard in captivity to provide enough favorite spots for them to move around. And now she's starting to use the entire mew, which is huge. I think that feels better. I'm sure she'll be right back to normal soon. It will feel better.
Next, Michelle's off to visit a cuddly creature in need of a quick fix.
Oh, he's tiny. I think he got smaller since the last time I saw him.
But this little guy's not ready to go down without a fight.
He's little, but he's got some fights, doesn't he? Yeah.
From giant to gentle, Dr. Michelle Oakley serves them all. Today, Michelle's heading to Midnight Sun Farm, preparing to castrate a pint-sized alpaca.
So he's really tiny, like pocket size. So Carolyn doesn't want those genetics in the rest of her herd, and that's why we're here, to make sure that doesn't happen. Hey,
Hi,
how's
Michelle.
it going? Nice to see you again. Yeah. Today is also extra special because Dr. Amy Doyle happens to be in town, so she's actually going to assist with the castration. You needed just one little guy neutered, is that right?
Yeah, one guy neutered.
Okay.
So.
And are you sure their both testicles are there? Have you?
I'm pretty sure.
Okay, good. We'll have another check.
Okay, sure. The little guy, the fact that he's small could mean he has some kind of genetic problem, and I don't want to pass that on through my herd. This way, when he's castrated, he can live with the females, like where he is, and they're not as rough, so he will not get beat up.
Oh, he's tiny. I think he got smaller since the last time I saw him. Hey, buddy.
So we'll just, it's okay, bud.
Hi. Well, hi, how are you?
Hi.
So I'm just trying to feel to make sure he has both testicles descended. There's definitely one. Oh, goodness, hello. And there's one that's trying to slip away, but it's there. Okay.
I think I can do it.
Okay. Ooh, nice. Looks like 40-ish, 42. Those are kilos, right? Or is that pounds?
Pounds.
Oh my gosh. Okay, that's amazing. Can I just lift that and see if that feels like 45 pounds to me? Okay. Oh yeah, he's not though. Okay.
Because I don't think I could lift.
Yeah, 40. Yeah, more
than that. Way,
right.
You know what I mean?
Oh, he's way tinier than we thought. Okay, well that's okay. Sorry, I don't mean to like rub it in, buddy. He's a little small, actually more than a little. He's about half the size of the other male alpacas his age. So he's definitely not a breeding candidate. It's pretty amazing. They're both the same age. So clearly something didn't quite work out right for him. Right from the beginning, she said he ate well, he was small. He's actually really well proportioned and fairly well muscled and feisty as all get out, but just didn't get the size.
With the average height of an alpaca around 3 feet at the shoulder and the weight around 170 pounds, looks like this little guy's never going to measure up to his furry friends.
He's like a house alpaca.
Yeah, I know.
Apartment size. He should start breeding those to sell them.
Yeah.
Oh wait, we're here to castrate him, never mind.
In the Yukon, an operating room can appear anywhere, even right outside a hay shelter.
Okay. So we're just putting him on the table.
Good boy.
It's okay.
Oh.
He's little, but he's got some feist, doesn't he?
Yeah. Okay. I'll just get his legs tied and then.
Okay, sure.
That'll help.
Once you get them in position, it's really just getting the sedation in. They don't have to be completely out. We can just use a local so they don't feel any of the castration. You got that foot?
I do.
Okay. So it's a lot faster than doing a horse castration or a bison castration or even wolverine castration or any of the other types that I've done. These fingers are made for pushing testicles into the scrotum. And that's just what I'll do. Okay. We'll see what he does with this. Don't cut my fingers. I'm gonna try. It's fairly straightforward. We'll make a cut over each testicle just like you do with a horse, over each scrotum sac, and then get them out. There it is. Oh yeah, it's still closed, right? Yeah, so I just got the first one out. Clamp and tie. And then tie it off. That all looks good. And I'm gonna do the next one. Alpaca castrations are pretty easy. They're pretty low key, low stress. There it is, okay. Other days with alpacas can be a rodeo. Some days we get in here and everything goes smooth as silk, and other days I leave with like spit all over my head. So it really depends on understanding the behavior of the animal and how to move them. Number 2 is out. So Carolyn, I'm gonna leave these open because they're just kinda, I think it's just too risky to close them.
Yeah.
I did a closed castration, so nothing's gonna herniate out of there.
Okay.
Like this little tunic is still around it, plus it's tied off.
Okay.
So we left the area open, so if there's any infection, it will drain out. Look, he's good.
Oh, he's ready to
Good,
get up.
okay. It went great. It was easy peasy. The table helps, I think.
Yeah. There we go. I got a little head. Okay.
You know, this castration went great.
I got him. You might have to hold his head
I got
because
him,
it'll be floppy.
Okay, it's okay. It's okay.
You know, it can be exciting to have to chase some of the other animals around and, you know, try and really use my brain to figure out how we're logistically going to get a hold of this animal.
Okay.
Oh, Mom!
He's
Oh,
calling
that's
his
so
mommy.
sad. But it's also nice to have an easy day with an alpaca. We got to do an alpaca selfie. Cheese! Say no nuts.
No nuts.
Oh my God. And sometimes those are the best days.